Dry January is a popular trend. It means abstaining from alcohol for the whole month. But for some, that may not be so easy. Dr. Anil Bachu is here, a psychiatrist from Baptist Health, to talk about the problems related to drinking and those who want to seek help. Doctor, thank you for coming in. It's great to see you.
Good morning. Thank you.
Appreciate you being here. Now, you work in the detox unit over at Baptist?
Yes. I work as an inpatient psychiatrist, and I also work on the detox unit.
How would you define alcoholism?
So alcoholism is often referred as alcohol use disorder. It is a chronic use of alcoholism despite of negative consequences and significant alterations in day-to-day living.
Yeah. So, how do we know that we may have a problem with alcohol? How do we know we may be an alcoholic? Is it the amount we drink? Is it how we consume it?
Good question. So we call it as the 5 C's of alcoholism. The C stands for cravings, compulsive use, loss of control, continued use despite of maladaptive behaviors, and also loss of control of drinking. You know, we tend to often ask our patients to answer 4 questions. It's called cage questions.
Mm-hmm.
You know, the C stands for, do you often anytime you felt like you need to cut down on your drinking?
Mm-hmm.
And A stands for, have you ever feel annoyed or criticized by other people by your drinking? And G stands for, have you ever felt guilty for your drinking? And E stands for, are you using alcohol as an eye opener, like to decrease the hangover from last night? If you answer 2 questions for these 4 questions, then we need to start asking our patients to get professional help.
Okay. And sometimes that isn't something that people want to do willingly, right? So they need to, loved ones need to step up and tell me how that works.
Yeah, so usually the loved ones are more affected than the actual people realizing it. So many times we get our patients brought in by their families to get help because of their dependence on the alcohol, development of tolerance, like needing more alcohol to get that equal buzz, and then the withdrawal symptoms, which are pretty dangerous.
So some people, you know, it's obvious that they have a problem with alcohol. So what would you call normal alcohol intake that isn't something to worry about?
Yeah, the nutritional guidelines suggest that, you know, in women, 1 drink per day is okay, and in men, it's 2 drinks. Like on a weekly basis, it's 7-14.
Right. Okay.
And we call it as binge drinking for women if they drink more than 4 drinks in a 2-hour period, or 5 drinks in men in 2-hour period. And if this is happening more than a few times a week, it's called binge drinking.
It's called binge drinking, and a sign that you may have a problem. Now, the physical problems that are associated with alcoholism are pretty well documented, right?
Right.
But it's got to take a terrible mental toll on your life and the life of those people you love. Talk a little bit about the mental toll it takes.
Absolutely. So alcohol is classified under depressant. So though alcohol gives you a short euphoric feeling when they drink, but it's a depressant. So it causes a long-term depression in people, and it causes severe anxiety in people, and then dependence issues and tolerance issues. Along with the mental health, there's a lot of physical problems which cause death in people. That includes heart problems, liver problems, increased lipids, you know, high cholesterol, and then hypertension.
The anxiety that must just come with trying to continually hide your alcohol abuse, it must be just devastating.
Totally, totally. That's the biggest problem. You know, anxiety is one of the most common psychiatric conditions throughout the world. Like there's an estimate of about like 45% of the world population do have anxiety in some form.
Well, you know, there's an awful lot of folks out there who may be watching this now, or they know somebody who really would like to get a handle on this problem. So what's a good first step?
So the first step first thing is, like, you know, for the person who is drinking, acknowledging the problem is the first step. Learning to understand that alcohol is causing significant impairment in their life. And then the relationship issues, financial difficulties, police problems like tickets. So those are the first things that they need to understand this and acknowledge it. And then reaching out to the friends and family, and then joining the support groups like Alcoholics Anonymous.
Right.
And if these things are not working out, we definitely need to get the professional help, you know, on professional help.
Yeah, and when you say professional help, because there are a lot of people who are afraid of a life without alcohol because they've lived with alcohol for so long in their lives, but you're here to help them get past the initial withdrawal phases and all the rest of that. You mentioned there's medications that help people get through that?
Totally. So the withdrawal symptoms consist of severe anxiety, tremulousness, sweating, headaches, nausea, vomiting. So these are acute phases. And then, people can get confused. They could get hallucinations, like seeing things which are not real or hearing things which are not real, and seizures. These are the acute withdrawal symptoms that people need to look at if they did not have a drink for a day. So at that time, we need to get immediate attention. That's called, people can be admitted in a hospital for detox, what we call as. We use medications which are similar to alcohol. We call it as benzodiazepines for a short period of time to decrease these withdrawal symptoms, and then we transition them to either inpatient or outpatient depending on the patient needs.
So there are ways to get through this.
Totally.
Just make that decision and your life will be so much better when you put this behind you, or at least learn to cope with it.
Absolutely. Once this acute phase is gone, we can actually give them something called medication-assisted treatment, as they could take it as an outpatient. There are medications like naltrexone, acamprosate, or sometimes gabapentin that can be replacing the alcohol for a short period of time, and then to decrease the cravings, to decrease the symptoms from the withdrawals.
Okay. Oh, such good resources. Doctor, I know we've just put up the information for Baptist Health there for folks who want to go online and get a lot more information. Really enjoyed talking with you about an important subject. Thank you, Doctor. Appreciate you being here.
Nice meeting you.
Yeah, absolutely. You too.